Hi, I'm Cynthia Saville. I'm going to be presenting my audiologic rehabilitation report and plan for an adult. The client, Sharon Parker from Hampton, Virginia, was born on September 20th, 1955. Her age on the date of this report was 56 years, 7 months, and 2 days. She reported that she never had any previous hearing problems, but that as she had gotten older, her hearing had gotten worse. She admitted that she did not tell anybody she was having hearing trouble because she did not wish to bother anybody. Sharon divorced her husband of 22 years over 3 years ago, and her daughter is away at college. She did not want to say anything to her physician at first because she feared there would be repercussions at her work. Also, she did not want to be stigmatized for her hearing problem and did not want others to see her as getting old. However, recently, her hearing problems have become more noticeable and have had a negative impact on her work. She reported that she's been constantly asking people to repeat themselves because it sounds like they're mumbling, and once they've talked louder, she can hear them. She reported that she could hear men's voices easier than women's voices. She initially went to a primary care doctor who gave her a physical exam and used an otoscope to look into her ears. He did not find any wax buildup in her ears. Her physician then referred her to me for further testing. I conducted a pure tone audiometry exam on Sharon to determine her hearing thresholds for both ears. During air conduction testing, she wore earphones and was told to raise her hand when she heard the noise being pure tones of controlled intensity or volume. The minimum volume that was required for her to hear the sound was then recorded on the audiogram. I then placed a bone oscillator against her mastoid bone behind each ear to test for bone conduction. I also had her take the hearing handicapped inventory for the elderly, which I have right here, and it's a questionnaire that she filled out based on her hearing abilities without her hearing aids. And the abbreviated profile of hearing aid benefit, which is another questionnaire, which has a section for without hearing aids, because at this point in time she doesn't have them. So I had her fill out that side. This was to gain more insight into her hearing loss and determine whether the hearing aids would be beneficial for her. In the assessment, Sharon's audiogram revealed a high-frequency, bilateral, symmetric, age-related, moderate sensorineural hearing loss in both ears. My diagnosis is that she is suffering from presbycusis. This has affected her ability to hear conversational speech and in turn has affected her life at home and at work. I am recommending that she be fitted for binaural amplification. She will come in for additional testing to see which kind of hearing aid would be most suitable for her. She will also take the hearing handicap inventory for the elderly and the abbreviated profile of hearing aid benefit once again to determine if the hearing aids are helping her. I will also be referring her to a speech-language pathologist who can work with her and instruct her on speech reading skills such as lip reading. This will further assist her in communication. She will also need further assessments with me as time goes on because presbycusis is progressive, so it only gets worse. We can address other options, such as assistive listening devices, later on as necessary. Thank you.